Responsible for the UAP's actions and performance. The nurse must correct the UAP's performance to ensure the client is cared for safely in the hospital or the home. 6.1. The nurse should go through the chain of command when attempting to make a change. 2. This may be an appropriate action at some point, but this would not be implemented until after assessing the old form and identifying areas to be changed. 3. The nurse should be a change agent. 4. The staff nurse should be a part of the solution to a problem. Volunteering to be on a committee of peers is the best action to effect a change. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, knowledge-making nursing decisions. There will be management questions. On the NCLEX-RN registered. Concepts of management is included under the category safe and effective environment and subcategory management of care. This is a knowledge-based question. 7.1. Because this procedure is performed in the radiology department and is testing the gastrointestinal system, the cardiac catheter lab does not need to be informed of the procedure. 2. The client must be NPO for 8 to 10 hours before the procedure. Therefore, the dietary department should be notified to hold the meal trays. 3. The procedure is performed using barium or gastrographin, neither of which contains any nuclear material. The nuclear medicine department does not need to be informed of the procedure. 4. The procedure does not involve the clinical laboratory, therefore, this department does not need to be notified. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The test taker must be knowledge able of the role of all members of the multidisciplinary healthcare team. Referrals are included under the category safe and effective care environment and subcategory management of care. 8.1. This client is unstable and should not be assigned to a new graduate nurse. 2. This client is being prepared for a test in the morning and is the least acute of the clients listed. The new graduate should be assigned to this client. 3. This client is hypokalemic secondary to diarrhea and is at risk for cardiac dysrhythmias. This client should be assigned to a more experienced nurse. Short bowel syndrome is a malabsorption disorder caused by the surgical removal of the small intestine or rarely due to the complete dysfunction of a large segment of bowel. 4. A client returning from surgery with a sigmoid colostomy is at risk for postoperative complications and should be assigned to a more experienced nurse. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which client is the most stable, which makes this an accept question. 3 clients are either unstable or have potentially life-threatening conditions. 9.1, 2, and 5 are correct. 1. The nurse should not administer any PO medications since the client is NPO. Answers Chapter 5 Gastrointestinal Management 123-2. This medication is PO, therefore, this medication should not be administered until after the endoscopy. 3. This is an intravenous medication, so it can be administered even though the client is NPO. 4. This is an intravenous medication, so it can be administered even though the client is NPO. 5. This is a PRN medication and it is PO, therefore, it should not be administered until after the procedure. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The test taker must be able to read a medication administration record, MAR, be knowledgeable of medications, and be able to make an appropriate decision as to the nurse's most appropriate intervention. 10.1. The client with Barrett's esophagus is expected to have dysphagia, difficulty swallowing, and pyroisis, heartburn. Therefore, this client would not be assessed first. 2. Proctitis is an inflammation of the anus and the lining of the rectum, affecting only the last 6 inches of the rectum. Symptoms are ineffectual straining to empty the bowels, tenesmus, diarrhea, rectal bleeding and possible discharge, involuntary spasms and cramping during bowel movements, left-sided abdominal pain, passage of mucus through the rectum, and anorectal pain. Since the signs/symptoms are expected, this client would not be assessed first. 3. Jaundice and ascites are expected in a client with liver failure, therefore, the nurse should not assess this client first. 4. The client has a urinary output of less than 30 ml/hr. Therefore, this client may be going into renal failure and should be assessed first. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions, the test taker should ask, is it normal or expected for the disease process? If it is normal or expected, then do not assess this client first. If more than one option is not expected or normal, then the test taker should ask which client is in a more life-threatening situation, needs more assessment, or may need the nurse to notify the healthcare provider. 11.1. Altered nutrition is a concern, but a client can live for several weeks on minimal intake. 2. Self-care deficit is a psychosocial problem, physiological problems have priority. 3. Impaired body image is a psychosocial problem, physiological problems have priority. 4. Fluid and electrolyte imbalance can cause cardiac dysrhythmias. This is the priority problem. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the NCLEX-RN registered integrates the nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnoses for clients. 12.1. This is a routine medication that has a time frame of 30 minutes before and after the scheduled time to be administered. This medication does not need to be the first medication administered. 2. Aricept can be administered within a 30-minute time frame. This medication does not need to be the first medication administered. 3. A mucosal barrier agent must be administered before the client eats in order for the medication to coat the gastric mucosa. This medication should be administered first. 4. Lovenox can be administered within the 30-minute time frame. This medication does not need to be the first medication administered. Content: medical/surgical, category of health alteration, gastrointestinal integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis. Making nursing decisions, the test taker should kn. Ao medications that are priority medications, such as life-threatening medications, insulin, and mucolytics, carafate. These medications should be administered first by the nurse. 124. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 13. 1. A client who is 6 hours postoperative abdominal surgery would be expected to have decreased bowel sounds, therefore, this client would not be assessed first. 2. Surgery is scary, and the client who is crying and upset should be assessed, but not prior to a potentially life-threatening surgical emergency. Psychosocial problems do not take priority over physiological problems. 3. A hard, rigid abdomen indicates peritonitis, which is a life-threatening emergency. This client should be assessed first. 4. The client who is 2 days postoperative and who is complaining of and rating pain as an 8 should be assessed, but the pain is not life-threatening and, therefore, does not take priority over the patient with probable peritonitis. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions, when deciding which client to assess. RST, the nurse should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 14.1. Because a client undergoing an elective procedure such as a gastric lap banding is usually healthy prior to the surgery, an elevated postoperative WBC count which this client has may indicate infection and, therefore, requires notifying the HCP. 2. The HNH of 1236 is within normal limits. Therefore, this laboratory result does not warrant intervention. 3. The glucose level is elevated, but many clients who are overweight have diabetes. This client must be at least 50 pounds overweight to have gastric bypass surgery. 4. A serum potassium level of 4.5 milliequivalent/L is within normal limits, therefore, this does not warrant notifying the healthcare provider. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if a laboratory value is normal for the client's disease process or medications the client is taking, or if the healthcare provider should be notified. 15.1. A client who is overweight and having abdominal surgery is not at a higher risk for postoperative complications than any other client. 2. The client's high blood pressure should be monitored closely and medications administered to decrease the hypertension, but this would not cause the client to have a higher risk for postoperative complications. 3. The location of the incision for a cholecystectomy, the general anesthesia needed, and a heavy smoking history make this client high risk for pulmonary complications. 4. Use of marijuana daily does not increase the risk of pulmonary complications for a client having gastric surgery. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. This is an except question but it does not say all the options are correct except only one option would cause the nurse to suspect high risk of postoperative complications. Remember, smoking cigarettes puts clients at risk for multiple problems, so it would be a good choice. 16. Correct answer, 3, 2, 1, 4, 5, 3. The nurse must first assess the drainage in the bag for color, consistency, and amount. 2. After removing the bag, the nurse should assess the site to ensure circulation to the stoma. A pink, moist appearance indicates adequate circulation. 1. The nurse should cleanse the area with a mild soap and water to ensure that the skin is prepared for the adhesive paste. 4. The nurse should then apply adhesive paste to the clean, dry skin. 5. The ostomy drainage bag is attached last. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. This is an alternate type of QESTI. On included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. Obtaining informed consent and performing an assessment should always be the first interventions. Answers Chapter 5 Gastrointestinal Management 125-17. 1. The nurse must first obtain the operative permit, or determine whether it has been signed by the client, prior to implementing any other orders. 2. The client cannot give informed consent after receiving pain medication, therefore, administration of morphine cannot be implemented first. 3. The operating room staff usually performs shave preps, but the nurse would not implement this prior to medicating the client. 4. The on-call IVPB is not administered until the operating room, or, is prepared for the client. New standards recommend that the prophylactic IVPB antibiotic be administered within 1 hour of opening the skin during a surgical procedure. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The NCLEX-RN registered blueprint includes PE. Operative nursing care. The nurse must be knowledgeable of preoperative and postoperative care, which is generic for all clients undergoing surgery. Obtaining informed consent is a priority intervention. 18.1. Evisceration is the removal of viscera, internal organs, especially those in the abdominal cavity. If the bowels protrude from the abdominal incision, the nurse must apply sterile normal saline gauze and then notify the client's surgeon. 2. The nurse can place an ADB pad on the normal sterile saline gauze. 3. The nurse can assess the bowel sounds, but not prior to applying sterile normal saline gauze. 4. The client should be placed in the supine position. The left lateral position will not affect the client's abdominal evisceration. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions. The test taker should apply the nursing process in questions that ask, which intervention should the nurse implement first? If the client is in distress, do not assess. The nurse should do something directly to help the client's situation. 19.1. This client with a paralytic ileus would be expected to have absent bowel sounds, therefore, this client should not be assessed first. 2. The client who is postoperative abdominal surgery should have a soft, tender abdomen, therefore, this client should not be assessed first. 3. Wound dehiscence is the premature bursting open of a wound along surgical suture, and is an emergency that would require the nurse to assess this client first. 4. This client should be prepared for transfer to the rehabilitation unit, but not prior to assessing a client with a complication of surgery. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The nurse must determine which client is experiencing an unexpected or abnormal situation for the surgery or condition. All the clients should be assessed and cared for, but the nurse must determine which one should be assessed first. 21. The primary nurse's instruction to the UAP to assist the client to the bathroom is an appropriate delegation that ensures the safety of the client. It requires no action by the charge nurse. 2. There is no information in the STEM that indicates the client needs a bedside commode. Therefore, this is not an appropriate action. 3. The UAP can assist a client who is stable to ambulate, therefore, this is not inappropriate delegation. 4. An adverse occurrence report is completed whenever potential or actual harm has come to the client. Ambulating the client with assistance is not harmful. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. The nurse must ensure the UAP can perform any delegated nursing tasks. It is the nurse's responsibility to evaluate the task, and demonstrate and/or teach the UAP how to perform the task. 21.1. The ABGs reflect metabolic alkalosis, which is expected in a client who has excessive vomiting. Therefore, this client would not be assessed first. 2. Pain is priority because the nurse must determine if this is expected postoperative pain or a complication of the surgery. This client should be assessed first. 126. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 3. Dark green bile should be draining from the client's nasogastric tube, therefore, this client should not be assessed first. 4. The client who is complaining of being constipated would not be priority over a client with surgical pain. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. When deciding which client to assess RST, the nurse should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected option, the test taker should determine which situation is more life-threatening. 22.1. The nurse should first appraise the situation and not do anything. This is the pivotal point at which the nurse can return the anger or reappraise the situation. The most important action to take is to empathize with the UAP and to try to find out the provocation for the behavior. 2. The primary nurse could tell the UAP to leave the unit, but this is responding to the anger and not the reason for the anger. 3. The comment may need to be reported to the charge nurse, but not until the primary nurse can determine what caused the comment. The UAP may be upset about something else entirely. 4. This is not the first action when dealing with someone who is angry. This comment may cause further angry behavior by the UAP and will not diffuse the situation. The nurse is the professional person and should control the situation. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues addressing how to deal with conflict and personnel issues. 23.1. Beneficence is the ethical principle to do good actively for the client. Because the client is in the ICU, the client is critically ill and does not need any type of news that will further upset the client. This statement supports the ethical principle of beneficence. 2. The statement supports beneficence, which is to do good. 3. This statement avoids directly telling the client the other individual is dead. 4. This statement supports the ethical principle of veracity, which is the duty to tell the truth. This statement will probably further upset the client and cause psychological distress, which may hinder the recovery period. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nursing care that addresses ethical principles including autonomy, beneficence, justice, and veracity, to name a few. 24.1. A copy of the advance directive should be placed in the client's chart, but it is not the nurse's first intervention. 2. The nurse should first inform the HCP so the order can be written in the client's chart. The HCP must write the Do Not Resuscitate, DNR, order before the client's wishes can be honored. 3. The person with the durable power of attorney for healthcare can make healthcare choices for the client if the client is unable to verbalize his or her wishes, but the first intervention is to have the HCP write a DNR order. 4. The client has a right to make this request, and the chaplain does not need to talk to the client about the advance directive. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management question. NS on the NCLEX-RN registered. Advanced directives is included under the category safe and effective environment and subcategory management of care. 25.1. The client's H&H is not within normal limits, but remember, hemoglobin 9. Think about transfusion time. This laboratory information does not warrant immediate intervention. 2. A soft, non-tender abdomen is expected and does not warrant immediate intervention by the nurse. 3. The client's apical pulse, AP, is above normal and the B/P is low, which are answers Chapter 5 Gastrointestinal Management. 127 signs of hypovolemic shock, which warrants immediate intervention by the nurse. 4. Coffee ground drainage indicates old blood, which would not be unexpected in the client who has esophageal bleeding. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. The test taker should ask, is the assessment data normal for the disease process? If it is normal for the disease process, then the nurse would not need to intervene. If it is not normal for the disease process, then this warrants intervention by the nurse. 26.1. Getting a resident up in a wheelchair for meals is an appropriate delegation to an unlicensed assistive personnel, UAP. This task does not require nursing judgment. 2. Assessing an incontinent client's perianal area requires nursing judgment and cannot be delegated to the UAP. 3. Discussing requirements with the client for going out on a pass should be done by the nurse responsible for completing the required documentation and providing any medication that the resident should take along. 4. Explaining colostomy care is teaching, and the RN cannot ask the UAP to teach. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis, making nursing decisions. The nurse cannot delegate assessment, evaluation, teaching, administering medications, or the care of an unstable client to a UAP. 27.1. Checking the patency of a PEG feeding tube requires nursing judgment, and feeding the client through the tube is based on this judgment. The unlicensed assistive personnel, UAP, should not be asked to perform this task. 2. The nurse should assess the coccyx and the area where the duodenum should be placed. The UAP should not be asked to perform this task. 3. The UAP can apply non-medicated ointment to protect the client's perineum when bathing and changing the client's incontinence pads. This will protect the client from skin breakdown. 4. The nurse should not delegate suctioning during feeding to a UAP. This indicates the client is unstable. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. When the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that allows each member of the staff to function within his or her full scope of practice. Do not assign a task to a staff member that requires a higher level of expertise than that staff member has. Similarly, do not assign a task to a staff member that could be assigned to a staff member with a lower level of expertise. 28.1. The client with a gastrostomy tube cannot eat or drink oral fluids, therefore, this behavior warrants intervention by the nurse. 2. At the long-term care center, the clients are allowed to go outside and the unlicensed assistive personnel, UAP, ambulating the client with a safety belt is appropriate behavior. 3. Assisting the client with an activity is an appropriate behavior by the UAP in a long-term care center. 4. Giving a back rub to a client on bed rest is a wonderful thing for the UAP to do for the client. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the nurse must ensure the UAP can perform any delegated nursing tasks. It is the nurse's responsibility to evaluate the task and demonstrate and/or teach the UAP how to perform the task. It is also the nurse's responsibility to intervene if the UAP is exhibiting an unsafe behavior. 29.1. The nurse should demonstrate the procedure on a model, but the first intervention should be to assess, to determine whether the client has any questions. 2. The nurse should provide the client with written instructions, but the first intervention 128 prioritization, delegation, and management of care for the NCLEX-RN registered examination should be to assess, to determine whether the client has any questions. 3. The client cannot learn if he has any questions or concerns. Therefore, the first intervention is to ask the client whether he has any questions. The nurse must allay any of the client's concerns or fears before beginning to teach the client. 4. The nurse should show the client all the equipment, but the first intervention should be to assess, to determine whether the client has any questions. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis. Making nursing decisions, the nurse should always apply the nursing process when answering a question requiring the nurse to determine which intervention to implement first. The first part of the nursing process is to assess. 31. The nurse should first assess the client's neurological status to determine the status of the client. 2. The nurse may need to contact the client's HCP, but the nurse should assess the client first, prior to contacting the HCP. 3. Increasing confusion is a symptom of hepatic encephalopathy, and checking the client's ammonia level would be appropriate, but not prior to assessing the client. 4. The nurse should assess the client first, prior to the LPN obtaining further data. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions, anytime the nurse receives information about a client, who may be experiencing a complication, from another staff member, the nurse must assess the client. The nurse should not make decisions about the client's needs based on another staff member's information. 31. Correct answer: 3, 1, 4, 5, 2, 3. The nurse should first put on non-sterile gloves, due to body fluid contamination. 1. The nurse should remove the bag carefully and ensure no drainage in the bag gets on the client's skin. 4. The nurse should ensure the stoma site is moist and pink. 5. The area around the stoma should be cleansed with soap and water and allowed to dry thoroughly. 2. Lastly, the nurse should apply the new colostomy bag. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. The nurse must list the interventions in order of priority. This is an alternate type of question included in the NCLEX-RN registered blueprint. Remember, standard precautions are always a priority. 32.1. Even though the client is not prescribed this medication by the healthcare provider, the nurse cannot delegate any type of medication administration to the unlicensed assistive personnel, UAP. 2. In some situations, the UAP may be able to perform tube feedings in the home, but the nurse should assign the least invasive procedure to the UAP. 3. In some situations, the UAP may be able to do colostomy irrigations in the home, but the nurse should assign the least invasive procedure to the UAP. 4. The UAP can wash and dry the client's hair, as this is the least invasive task, so this would be the most appropriate task for the nurse to delegate to the UAP. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, TE, aching, evaluation, medications, or an unstable client to the UAP. The nurse should always assign the least invasive task or the task that requires the least educated employee. 33.1. Since the UAP cannot accept gifts or money from the client, this would not warrant an intervention. 2. The UAP can bring flowers to the client. This does not violate any rules. 3. The UAP should not take money from the client to pick up prescriptions, and the UAP is not responsible for doing errands for the client. If money is missing or medications are missing, this could result in a difficult situation. The home health, HH, nurse should tell the UAP not to do this type of activity for the client. Answers Chapter 5 Gastrointestinal Management 129.4. Cleaning the house is not part of the UAP's job description, but this would not warrant intervention by the HH nurse. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective environment, management of care, cognitive level, application making nursing decisions. The nurse is responsible for knowing the scope of practice for the healthcare team members who are his or her subordinates. 34.1. The client is having signs/symptoms of diverticulitis, which can be potentially life-threatening. Therefore, the client should get medical assistance immediately. 2. The client needs to be seen by a medical doctor to be prescribed antibiotics. Therefore, there is no reason for an HH nurse to visit the client. 3. The nurse must have knowledge of disease processes. The client is verbalizing signs of acute diverticulitis, which requires the client to be NPO and prescribed antibiotics. The client needs to receive immediate medical attention. 4. The client is verbalizing signs/symptoms of acute diverticulitis, which requires medical attention. It does not matter what the client has had to eat. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse must be knowledgeable in expected medical treatments for the client. This is a knowledge-based question. 35.1. According to the NCLEX-RN registered test blueprint under management of care, the nurse should be knowledgeable of referrals. The wound care nurse is trained to care for clients with colostomy and is knowledgeable in treating complications. 2. The most appropriate intervention is to refer the client to a member of the multidisciplinary team who has expertise in the area in which the client is having the problem. In this case, the wound care nurse has the expertise to care for the stoma site. 3. After 2 weeks, the nurse should obtain further assistance in treating the stoma site. 4. Carrea paste will not be effective in treating the excoriated area, therefore, this is not an appropriate intervention. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These will be tested on the NCLEX-RN registered exam. 36.1. Denial is the first stage of grief. Anger is the second stage of grief. Why me? It's not fair. The individual recognizes that denial cannot continue. Because of anger, the person is very difficult to care for due to misplaced feelings of rage and envy. 2. Bargaining, I'll do anything for a few more years. The third stage involves the hope that the individual can somehow postpone or delay death. The client's comments indicate bargaining. 3. Depression, I am so sad, why bother with anything? During the fourth stage, the dying person begins to understand the certainty of death. Because of this, the individual may become silent, refuse visitors, and spend much of the time crying and grieving. 4. Acceptance, it's going to be okay. In this last stage, the individual begins to come to terms with her/his mortality or the mortality of a loved one. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, evaluation, client needs, psychosocial integrity, cognitive level, analysis making nursing decisions. The nurse caring for clients who are dying needs to know the stages of death. Each stage of death requires the nurse to address the psychosocial needs of the client in a different way. 37.1, 3, and 4 are correct. 1. This is a goal for EOL care. 2. This will need to be done during the client's dying process, but it is not a goal for EOL care. 3. This is a goal for EOL care. 4. This is a goal for EOL care. 5. Addressing the financial cost of the dying process is not a goal for EOL care. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, psychosocial integrity, cognitive level, synthesis making nursing decisions. The nurse must know the role of the other areas of nursing. So 130 prioritization, delegation, and management of care for the NCLEX-RN registered exam that the nurse can refer the client and family to the appropriate resource. 38.1. Mexican American families are close-knit communities and often prefer to care for their own family members. Therefore, they would not seek hospice or palliative care. The nurse should attempt to help the client understand the philosophy, the benefits, and the help hospice can give the client and family. 2. The nurse should attempt to help the client and family understand hospice so the client can make an informed decision. 3. The healthcare provider does not need to be contacted to reaffirm the client is dying. 4. The nurse should first talk to the client and then to the family. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, psychosocial integrity, cognitive level, synthesis making nursing decisions. The client has a right to refuse any health care, but the nurse first must ensure the client fully understands the focus of the care, especially with cultural differences. When the client fully understands and then refuses the care, the nurse must respect the client's rights. The NCLEX-RN registered blueprint includes nursing care addressing cultural diversity. 39.1. Advance directive is a general term used to describe documents that give instructions about future medical care and treatments and who should make them in the event the client is unable to communicate. 2. A directive to physicians is a written document specifying the client's wish to be allowed to die without heroic or extraordinary measures. 3. Living will is a lay term used frequently to describe any number of documents giving instructions about future medical care and treatments. 4. The nurse is specifically describing the term durable power of attorney for health care. It is a document included in an advance directive. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, knowledge making nursing decisions. The nurse must be aware of documents clients use when addressing end-of-life issues. This is a knowledge-based question, but nurses must be able to ensure the client's last requests are honored. 41. Bereavement counseling is for the survivors, not the client. 2. This is the definition of bereavement counseling. 3. Bereavement counseling is for the survivors, not the client. 4. Bereavement counseling may include group counseling, but it could also be individual counseling. This is not the nurse's best response. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. The nurse must be able to explain the support provided by hospice. Losing a loved one is a huge loss to most people, and the nurse's responsibility is to help the survivors work through the stages of grief. 41.1. Many nurses follow this practice, but no research has been completed to support this practice. 2. This is part of the Joint Commission's patient safety goals, not evidence-based practice. 3. Evidence-based practice is the conscientious use of current best evidence in making decisions about nursing care. Using the evidence, or research, to teach a client is evidence-based practice. 4. Reading the journal is a step in EBP, but EBP requires using the information in practice. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, diagnosis, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions. The NCLEX-RN registered blueprint include nursing care based on evidence-based practice. The nurse must be knowledgeable of nursing research. 42.1. The charge nurse should stop the nurse from recapping the needle, but not in front of the client. 2. The charge nurse should not reprimand the nurse in front of the client or client's family. The charge nurse should ask the nurse to step into the hall, where the client cannot hear. 3. Reprimanding the nurse is not the first action. 4. Notifying the house supervisor is not the first action. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe answers. Chapter 5 Gastrointestinal Management 131 and Effective Care Environment, Management of Care, Cognitive Level, Analysis Making Nursing Decisions. In any bus, including a healthcare facility, correcting a fellow staff member's behavior should not occur in front of a customer or, in this instance, the client. 43.1. The chief nursing officer should be informed, but this is not the first action. 2. The first action for the administrative supervisor is to make sure the clients receive care. The supervisor cannot allow the on-duty staff to leave until replacement staff members have been arranged. 3. The supervisor should call any staff that can get to the hospital in an attempt to staff the hospital, but this is not the first action to implement. 4. An emergency disaster protocol may be implemented, but the first intervention is to ensure the clients have a nurse on duty. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The nurse must be knowledgeable of emergency preparedness. Employees receive this information in employee orientation and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on safe and effective care environment. 44.1. The nurse cannot delegate any task requiring nursing judgment. Taking a client's history requires knowing which questions need to be asked to assess the client's problems. 2. Documenting the client's complaints is a nursing responsibility that the nurse must perform. It cannot be delegated to unlicensed assistive personnel, UAP. 3. The UAP can obtain the client's height and weight. This is the task the nurse should delegate. 4. The client's follow-up care may require teaching, judgment, or further assessment. Therefore, the nurse should not delegate this action to a UAP. When delegating to a UAP, the nurse must provide clear, concise, and specific instructions. The nurse cannot delegate teaching. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. An RN cannot delegate assessment, teaching, NG, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 45.1. The actions of the colleague indicate possible drug or alcohol impairment. The staff nurse is not in a position of authority to require the potentially impaired nurse to submit to a drug test. The administrative supervisor should assess the situation and initiate the appropriate follow-up. The nurse must make sure an impaired nurse is not allowed to care for clients. 2. The nurse is not a counselor, and a staff nurse should not attempt to confront an impaired colleague. 3. The administrative supervisor and the charge nurse are the only staff members who have the authority to send a nurse home. 4. The nurse should not attempt to determine the cause of the behavior. This is outside the nurse's authority. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions on the NCLEX-RN registered. Concepts of management is included under the category safe and effective environment and subcategory management of care. 46.1. Regurgitation, effortless return of food or gastric contents from the stomach into esophagus or mouth, is a common manifestation of GERD. Therefore, this client would not be assigned to the most experienced nurse. 2. Barrett's esophagitis is a complication of GERD. New graduates can prepare a client for a diagnostic procedure. 3. This client is exhibiting symptoms of asthma, a complication of GERD. Therefore, the client should be assigned to the most experienced nurse. 4. Pain is expected with a surgical procedure and a less experienced nurse could administer pain medication. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which client is the most unstable and would require the most experienced. 132. Prioritization, delegation, and management of care for the NCLEX-RN registered exam nurse, thus making this an accept type of question. 3. Clients are either stable or have non-life-threatening conditions. 47.1. The nurse should notify the HCP, but it is not the first intervention. 2. The nurse should assess the client for leg cramps, indicating hypokalemia, but the nurse should first ensure the client's cardiac status is stable. 3. The client is at high risk for cardiac dysrhythmias, due to hypokalemia. The nurse should first assess the cardiac status, then implement other interventions. Remember Maslow's hierarchy of needs. 4. The client will need 4 potassium, but this requires an HCP order. Therefore, this intervention is not implanted first. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, before selecting notify the HCPST. Correct answer: the test taker must examine the other three options. If information in any of the other options contains data that will relieve the client's distress, prevent a life-threatening situation, or provide information the HCP will need to make an informed decision, then the test taker should eliminate the notify the HCP option. 48.1. The charge nurse should discuss the client's anger with the client immediately because the client is preparing to leave the hospital. The charge nurse can talk with the primary nurse after talking with the client. 2. This is the first action for the charge nurse. The client is preparing to leave, and a delay in going to the client's room could result in the client leaving before the situation can be resolved. 3. The HCP should be notified, but the charge nurse should assess the situation first. 4. The client will be asked to sign the against medical advice form if he insists on leaving, but the charge nurse should attempt to resolve the situation successfully first. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions. The nurse should always PPLY the nursing process when answering a question requiring the nurse to determine which intervention to implement first. The first part of the nursing process is to assess. 49.1. Planning the care of the client cannot be delegated to an unlicensed assistive personnel, UAP, and the client, not the parents, should set the goals. 2. The UAP should stay with the client for an hour after a meal. Leaving the client after 20 minutes would allow the client time to induce vomiting. 3. This requires the nurse to utilize therapeutic conversation and nursing judgment. The nurse cannot delegate this intervention to a UAP. 4. The UAP can document the amount of food consumed on a calorie count form for the dietitian to evaluate. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. An RN cannot delegate assessment, teaching, NG, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 51. This is an assessment question and should be asked to determine what the client has attempted has been unsuccessful. 2. The amount of weight loss desired is not as important as assessment of previous unsuccessful strategies. 3. This is a therapeutic statement, but the nurse should assess the client. 4. This statement is not helpful, and the nurse working in a bariatric clinic should know that there are many options for weight loss, including surgery. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, health promotion and maintenance, cognitive level, analysis making nursing decisions. Assessment is the first step of the nursing process, and the TEST taker should use the nursing process or some other systematic process to assist in determining priorities. 51.1. During a laparoscopic cholecystectomy, carbon dioxide is instilled into the client's abdomen. Postoperatively, the gas migrates to the shoulder by gravity and causes shoulder pain. 2. This is not an emergency situation, and the nurse should explain this to the client. 3. The nurse should not tell the client to increase the pain medication. This is prescribing. Answers Chapter 5 Gastrointestinal Management 133-4. These pains are gas pains, but they are not intestinal gas pains that can be relieved by ambulation. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis. Making nursing decisions, the nurse must be knowledgeable of expect-ed medical treatment for the client. This is a knowledge-based question. 52.1. The medication is ordered every 4 hours and it has been less than 4 hours since the last medication was administered. The nurse cannot administer the PRN medication. 2. Lomotil is for diarrhea and the client has a soft, brown, formed stool, therefore, the nurse would not administer this medication. 3. The nurse should call the healthcare provider to discuss the situation. The client is nauseated and needs something, but there is nothing ordered. 4. The nurse should not tell the client there is nothing that can be done. The nurse needs to call the healthcare provider. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, before selecting notify the HCP. As the correct answer, the test taker must examine the other 3 options. If information in any of the other options contains data that will relieve the client's distress, prevent a life-threatening situation, or provide information the HCP will need to make an informed decision, then the test taker should eliminate the notify the HCP option. 53. 1, 3, and 4 are correct. 1. The HCP must order the insertion of a Sengstaken Blakemore tube, so this is a collaborative nursing intervention. 2. Assessing the client's vital signs does not require an HCP's order, so this is an independent nursing intervention, not a collaborative intervention. 3. This is a collaborative intervention that the nurse should implement. It requires an order from the HCP. 4. Obtaining laboratory data requires an HCP's order, so this is a collaborative intervention. 5. Monitoring the client's intake and output does not require an HCP's order, so this is an independent nursing intervention, not a collaborative intervention. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, this is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. 54.1. Hypoactive bowel sounds are not normal, but it would not warrant immediate intervention. As long as the bowels are moving, it is not an emergency. 2. The client should have 30 ml of urine output an hour, therefore, this information is normal and does not warrant immediate intervention. 3. These vital signs are normal, therefore, they do not warrant immediate intervention. 4. Coffee ground emesis indicates bleeding and old blood, and warrants intervention by the nurse. Further assessment is needed to determine if the client is hypovolemic and the HCP should be notified. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the test taker should ask, is the assessment data normal for the disease process? If it is normal for the disease process, then the nurse would not need to intervene. If it is not normal for the disease process, then this warrants intervention by the nurse. 55.1. The nurse should first determine if the client is hypovolemic prior to taking any other action. This will determine the nurse's next action. 2. The nurse should auscultate the client's bowel sounds to determine if they are present, but not prior to taking the client's pulse and blood pressure. 3. The nurse should assess the situation before notifying the HCP. 4. The nurse may need to reinforce the dressing if the dressing becomes too saturated, but this would occur only after a thorough assessment is completed. Content: medical/surgical, category of health alteration, gastrointestinal, integrated. 134 Prioritization, delegation, and management of care for the NCLEX-RN registered exam processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive vel, synthesis. Making nursing decisions. Before selecting notify the HCP as the correct answer, the test taker must examine the other 3 options. If information in any of the other options contains data that will relieve the client's distress, prevent a life-threatening situation, or provide information the HCP will need to make an informed decision, then the test taker should eliminate the notify the HCP option. 56. 106 GTTS per minute. The nurse must divide the total amount to be infused by 24 hours to determine the FOR rate. 2,550 ml divided by 24 equals 106.2. 5. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application. Making nursing decisions. The NCLEX-RN registered BLUP. RENT includes dosage calculations under pharmacological and parenteral therapies. This category is included under physiological integrity, which promotes physical health and wellness by providing care and comfort, reducing client risk potential, and managing health alterations. 57.1. The nurse must check the medication administration record, MAR, to determine the last time the client received any pain medication, but not prior to assessing the client first. Remember, assessment is the first step of the nursing process. 2. The nurse must assess the client's pain, not the unlicensed assistive personnel, UAP. The nurse cannot delegate assessment. 3. The first part of the nursing process is assessment. The nurse must first assess the client's pain to determine if the pain indicates a complication requiring medical intervention, or if this is routine postoperative pain, which is expected. 4. The nurse should not delegate the obtaining of vital signs to a client who may be unstable. The nurse must assess the client. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions. Anytime the nurse receives information about a client, who may be experiencing a complication, from another staff member, the nurse must assess the client. The nurse should not make decisions about the client's needs based on another staff member's information. 58.1. The client should stay on his or her right side for at least 2 hours post-procedure, so giving the client a urinal to void is an appropriate action and does not warrant intervention. 2. The client is not NPO after the procedure, so giving the client water is an appropriate action and does not warrant intervention. 3. Direct pressure is applied to the site and then the client is placed on the right side to maintain side pressure for at least 2 hours. Turning the client to the left side warrants intervention by the nurse so the client will not hemorrhage. 4. The unlicensed assistive personnel, UAP, can take the vital signs for the client who is stable, therefore, this action would not warrant intervention. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions. Delegation means the nurse is responsible for the UAP's actions and performance. The nurse must correct the UAP's performance to ensure the client is cared for safely in the hospital or the home. 59.1. Hot water increases pruritus, and soap will cause dry skin, which increases pruritus. Therefore, the nurse should discuss this with the UAP. 2. This will help prevent dry skin, which will help decrease pruritus, but this is not the client's first intervention. The nurse should first directly protect the client's skin. 3. Mittens will help prevent the client from scratching the skin and causing skin breakdown, which is priority for the client with liver failure. The client has decreased vitamin K, which will lead to bleeding. The client is also immunosuppressed, which will lead to infection. 4. Benadryl will help decrease the pruritus, but it will take at least 30 minutes to work. Protecting the client's skin integrity is priority. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, analysis. Making nursing decisions, the nurse should remember, if a client is in distress, and the nurse can do something to relieve the distress, that answers Chapter 5 Gastrointestinal Management 135 should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 61. This is passing the buck, and this is not the best option to select. The nurse should answer the client's question. 2. Milk thistle has an active ingredient, silymarin, which has been used to treat liver disease for more than 2,000 years. It is a powerful oxidant and promotes liver cell growth. This response gives the client factual information. 3. The nurse should not discourage complementary therapies. 4. This is a judgmental statement and the nurse should encourage the client to ask questions. Content: medical/surgical, category of health alteration, complementary alternative medicine, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application. Making nursing decisions, the nurse must be knowledgeable of complementary alternative medicine, which includes herbs used to treat medical conditions. 61.1. The laboratory technician draws serum blood studies, not the unlicensed assistive personnel, UAP. 2. The nurse should not request the UAP remove the N/G tube. This is an invasive tube and judgment is required to remove it. 3. The UAP can empty feces from a colostomy bag. This is not changing the colostomy bag, just emptying the feces. 4. The UAP cannot transcribe HCP orders. The UAP assists the nurse with direct client care. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, an RN cannot delegate assessment, teaching, NG, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. The test taker must be knowledgeable of the role of all members of the multidisciplinary healthcare team. 62.1. The normal serum sodium level is 135 to 145 milliequivalent/L. This sodium level is elevated, indicating the client is dehydrated, which warrants intervention by the nurse. 2. These are normal arterial blood gas results, therefore, the nurse would not need to intervene. 3. The normal serum potassium level is 3.5 to 5.5 milliequivalent/L, therefore, this laboratory information does not warrant intervention by the nurse. 4. A stool specimen showing fecal leukocytes would support the diagnosis of gastroenteritis and not warrant immediate intervention by the nurse. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if a laboratory value is normal for the client's disease process or medications the client is taking. 63.1. Fluid and electrolyte imbalance is priority because of the potential for metabolic acidosis and hypokalemia, which are both life-threatening, especially in the elderly. 2. The client will have diarrhea, but it is not priority over fluid and electrolyte imbalance. 3. The client will probably be NPO and will not want to eat, but this diagnosis is not priority over fluid and electrolyte imbalance. 4. The client's oral mucous membranes may be dry due to vomiting and diarrhea, but it is not priority over fluid and electrolyte imbalance. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The NCLEX-RN registered integrates the nursing process throughout the client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnosis for clients. 64.1. Pain should be assessed, even if it is expected for the client's diagnosis, if the other clients are stable. 2. The nurse needs to talk to this client, but should assess the client with pain first. 3. The client with IBD who is receiving total parenteral nutrition is stable and would not be assessed first. 136. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 4. The client with hepatitis B would be expected to be jaundiced and anorexic, so this client would not be assessed first. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker should use some tool as a reference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. Physiological needs have priority over psychosocial ones. 65.1. The nurse should assess the client for hypovolemia, but the first intervention is to assess the client's surgical wound to determine if wound dehiscence has occurred. 2. The nurse should determine the client's pain, but not prior to determining the cause of the pain. 3. Assessing the surgical incision is the first intervention because this may indicate the client has wound dehiscence. 4. The nurse should not administer pain medication without assessing for potential complications first. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. Assessment is the first step of the nursing process, and the test taker should use the nursing process or some other systematic process to assist in determining priorities. 66.1. The hemovac should be depressed, which indicates suction is being applied. The hemovac needs to be emptied and suction reapplied, which indicates the hemovac is not functioning appropriately. 2. The tube should be pinned to the dressing to prevent the client drain from accidentally being pulled out of the insertion site, but this does not indicate the hemovac is functioning appropriately. 3. The insertion site should be pink and without any signs of infection, which include drainage, warmth, and redness, but it does not indicate the hemovac is functioning appropriately. 4. The hemovac should be sunken in or depressed, indicating that suction is being applied, which indicates the hemovac is functioning appropriately. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The NCLEX-RN registered includes safe use of equipment. NT as a subcategory under safety and infection control, which addresses content on protecting clients, family/significant others, and healthcare personnel from health and environmental hazards. 67.1. The client should urinate 30 ml/hour, so 160 ml in 4 hours is appropriate, and the nurse should not assess this client first. 2. This client was just transferred from the post-anesthesia care unit, PACU. Therefore, the nurse should assess this client first to perform a baseline assessment and ensure the client is stable. 3. Flatulence, gas, indicates the bowels are working, which is normal for a client with abdominal surgery, so this client should not be seen first. 4. The client being discharged would be stable and not a priority for the nurse. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker must determine which sign/symptom is expected for the surgical procedure. Clients being transferred from more intensive nursing area to less intensive areas should be assessed upon arrival to the unit. 68.1. The client that is morbidly obese will have a large abdomen that prevents the lungs from expanding, and predisposes the client to respiratory complications. Having the client use an incentive spirometer will help prevent respiratory complications. 2. The client may be weighed daily, but this is not priority over respiratory complications. 3. Preventing deep vein thrombosis is an important intervention, but oxygenation is priority. 4. The nurse should get the client out of the bed as soon as possible to help prevent deep vein thrombosis, but not priority over oxygenation. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Answers. Chapter 5 Gastrointestinal Management 137 Making nursing decisions. The test taker should use some tool as a reference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. Oxygenation is priority. 69.1. The client with ulcerative colitis can have 10 to 12 loose stools a day. Therefore, this client should not be seen first. 2. This client should be assessed, but not priority over a client with a physiological problem. 3. This client has signs of dehydration, which is not expected when a client is vomiting. The client should remain hydrated even when the client is vomiting. 4. This is not normal, but it is expected for a client with hemorrhoids. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess that client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 71. Total parenteral nutrition is an intravenous medication. The nurse cannot delegate medication administration to the UAP. 2. The nurse cannot delegate medication administration to the UAP. 3. The LPN can administer medications to a client. 4. The RN cannot assign assessment to the LPN. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot assign assessment, TAC, evaluation, or an unstable client to an LPN. The nurse cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 138 Prioritization, delegation, and management of care for the NCLEX-RN registered exam clinical scenario answers and rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. Pyrosis is heartburn and is expected in a client diagnosed with GERD. The new graduate can care for this client and administer an antacid. 2. An endoscopy is a diagnostic test and the client should have bowel sounds, therefore, if the client has no bowel sounds, then this is an unexpected complication and requires a more experienced nurse. 3. This client is exhibiting symptoms of asthma, a complication of GERD. Therefore, the client should be assigned to the more experienced nurse. 4. An open cholecystectomy incision is just below the diaphragm and the client is at great risk to develop pneumonia, because of the pain and refusal to deep breathe. This client should have a more experienced nurse to ensure the client takes deep breaths. 2. The HCP would not need to be notified since the potassium level is within the normal limits of 3.5 to 5.5 milliequivalent/L. 2. The client's potassium level is within normal limits, so the nurse should continue to monitor the client. The normal level is 3.5 to 5.5 milliequivalent/L. 3. Hypokalemia can lead to cardiac dysrhythmias, but the client's potassium level is within normal limits. 4. The client will need potassium to correct the hypokalemia, but the client's potassium level is within normal limits. 3. 1 and 2 are correct. 1. An admission assessment is an independent intervention that the nurse should implement. 2. Evaluating blood pressure is an independent intervention that the nurse should implement. If the client is able, B/PS should be taken lying down, sitting, and standing to assess for orthostatic hypotension. 3. This is a collaborative intervention that the nurse should implement. It requires an order from the HCP. 4. Administering blood products is collaborative, requiring an order from the HCP. 5. The HCP must order any laboratory work, so this is not an independent nursing intervention. 4.1. A purple stoma indicates necrosis and requires immediate intervention, so the client should notify the HCP, therefore, the client understands the teaching. 2. The client should be on a regular diet, and the colostomy will have been working for several days prior to discharge. The client's statement indicates an understanding of the teaching. 3. The client should wear a colostomy pouch over the stoma, so it will collect the feces coming from the stoma. 4. A sigmoid colostomy must be irrigated daily, so the client will have a bowel movement daily. This statement indicates the client needs more teaching. 5. Answer, 94 ml/hour. First determine the total amount to be infused over 24 hours. 6.1. The client will have a nasogastric tube because the client will be NPO, which will decompress the bowel and help remove hydrochloric acid. 2. Preventing dehydration is a priority with the client who is NPO. 3. Ms. Kathy should question a sigmoidoscopy. Invasive tests are not completed during an acute exacerbation of diverticulosis. 4. The client is in severe pain and should be on bed rest, which will help rest the bowel. 7.1. The client should be on bed rest for 2 hours, but must be on the right side to prevent hemorrhaging. 2. The client must be on the right side for 2 hours to prevent hemorrhaging. 3. The client should be placed on the right side, same side as liver, to prevent hemorrhaging after the liver biopsy. 4. An incident report may need to be completed, but not prior to taking care of the client by placing the client on the right side. 8.1. The nurse must notify the infection control nurse as soon as possible so that treatment can start if needed, but this is not the first intervention. 2. Ms. Kathy must first have the nurse complete the adverse occurrence report, so there is written documentation concerning the situation. Then Ms. Kathy Scenario answers Chapter 5 Gastrointestinal Management 139 should notify the infection control nurse, who will arrange for post-exposure prophylaxis and then determine if the client has hepatitis. 3. Post-exposure prophylaxis may be needed, but this is not the first action. 4. The infection control nurse will check the status of the client whom the needle was used on before the nurse stuck herself. 9.1. The client with an inflated Sengstaken-Blakemore tube has acute esophageal varices bleeding and is not stable, therefore, this nursing task cannot be delegated. 2. The nurse cannot delegate assessment, teaching, evaluation, medications, or an unstable client. 3. The client with pruritus, itching, is stable and the unlicensed assistive personnel, UAP, can assist with showering and AM care, therefore, this task can be delegated by Ms. Kathy. 4. The nurse cannot perform a paracentesis, only an HCP can perform this procedure. Therefore, the UAP cannot assist the nurse. 10.1. This client's hemoglobin and hematocrit is low, but the client is receiving blood, therefore, this client is stable and does not need to be assessed first. 2. The client with ulcerative colitis would be expected to have 10 loose stools and the potassium level is within normal limits, therefore, this client does not need to be assessed first. 3. A hard, rigid abdomen and elevated temperature is indicative of peritonitis, which is an acute postoperative complication of abdominal surgery and requires immediate intervention. Ms. Kathy should assess this client first. 4. Green bile draining from the N/G tube is expected and does not require assessment by Ms. Kathy. 140 Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 141 Renal and genitourinary management. 6 You are the people who are shaping a better world. One of the secrets of inner peace is the practice of compassion. Dalai Lama 1. The nurse is caring for the following clients on a medical unit. Which client should the nurse assess first? 1. The client with acute glomerulonephritis who has oliguria and periorbital edema. 2. The client with benign prostatic hypertrophy who has blood oozing from the intravenous site. 3. The client with renal calculi who is complaining of flank pain rated as a 5 on a scale of 1 to 10. 4. The client with nephrotic syndrome who has proteinuria and hypoalbuminemia. 2. The nurse is inserting an indwelling catheter into a male elderly client. Which intervention should the nurse implement first? 1. Ask the client if he has any prostate problems. 2. Determine if the client has any betadine allergies. 3. Lubricate the end of the indwelling catheter. 4. Ensure urine is obtained in the indwelling catheter. 3. The nurse is preparing to administer intravenous narcotic medication to the client who has renal calculi and is complaining of pain rated as 8 on 1 to 10 pain scale. The client's vital signs are stable. Which intervention should the nurse implement first? 1. Clamp the 4 tubing proximal to the port of medication administration. 2. Administer the narcotic medication slowly over 2 minutes. 3. Check the medication administration record, MAR, against the hospital identification band. 4. Determine if the client's intravenous site is patent. 4. The nurse is administering medications to clients on a surgical unit. Which medication should the nurse administer first? 1. The narcotic analgesic morphine 4 infusion to the client who is 8 hours postoperative and is complaining of pain, rating it as a 7 on a 1 to 10 pain scale. 2. The aminoglycoside antibiotic vancomycin intravenous piggyback, IVPB, to the client with an infected abdominal wound. 3. The proton pump inhibitor pantoprazole, Protonix, IVPB to the client who is at risk for developing a stress ulcer. 4. The loop diuretic furosemide, Lasix, intravenous push, IVP, to the client who has undergone surgical debridement of the right lower limb. Questions 5. The nurse and unlicensed assistive personnel, UAP, are caring for clients on a surgical unit. Which action by the UAP warrants immediate intervention? 1. The UAP empties the indwelling catheter bag for the client with transurethral resection of the prostate, TURP. 2. The UAP assists a client who received an 4 narcotic analgesic 30 minutes ago to ambulate in the hall. 3. The UAP provides apple juice to the client with a nephrectomy who has just been advanced to a clear liquid diet. 4. The UAP applies moisture barrier cream to the elderly client with urinary incontinence who has an excoriated perianal area. 6. The charge nurse is making shift assignments to the surgical staff, which consists of 2 nurses, 2 licensed practical nurses, LPNs, and 2 unlicensed assistive personnel, UAP. Which assignment would be most appropriate for the charge nurse to make? 1. Instruct the nurse to administer all PRN medications. 2. Instruct the UAP to clean the recently vacated room. 3. Assign the LPN to change the client's ileal conduit bag. 4. Request the LPN to complete the admission for a new client. 7. The charge nurse is making assignments in the day surgery center. Which client should be assigned to the most experienced nurse? 1. The 24-year-old client who had a circumcision and is being prepared for discharge. 2. The client scheduled for a cystectomy who is crying and upset about the surgery. 3. The client diagnosed with kidney cancer who is receiving 2 units of blood. 4. The client who has end-stage renal disease and had an arteriovenous fistula created. 8. The nurse is completing the admission assessment on the client scheduled for cystectomy with creation of an ileal conduit. The client tells the nurse, "I am taking saw palmetto for my enlarged prostate." Which intervention should the nurse implement first? 1. Notify the client's HCP to write an order for the herbal supplement. 2. Ask the client why he is taking an herb for his enlarged prostate. 3. Consult with the pharmacist to determine any potential drug interactions. 4. Look up saw palmetto in the physician's desk reference, PDR. 9. The client scheduled for a D&C is upset because the HCP told her she has syphilis. The client asks the nurse, "This is so embarrassing. Do you have to tell anyone about this?" Which statement is the nurse's best response? 1. This must be reported to the public health department and your sexual partners. 2. According to the Health Insurance Portability and Accountability Act, HIPAA, I cannot report this to anyone without your permission. 3. You really should tell your sexual partners, so they can be treated for syphilis. 4. I realize you are embarrassed. Would you like to talk about the situation? 10. The nurse is caring for clients on the renal unit. Which task is most appropriate for the nurse to delegate to the unlicensed assistive personnel, UAP? 1. Instruct the UAP to calculate the client's urinary intake and output. 2. Request the UAP to double-check a unit of blood that is being administered. 3. Tell the UAP to change the surgical dressing on the client with a kidney transplant. 4. Ask the UAP to transfer the client from the renal unit to the intensive care unit. 142 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 11. The nurse is caring for clients on a renal unit and making assignments for the day shift. Which client should the nurse assess first? 1. The client diagnosed with interstitial cystitis who has urinary urgency and pain in the bladder. 2. The client with acute post-streptococcal glomerulonephritis who has hematuria with a smoky appearance. 3. The client diagnosed with Goodpasture syndrome who has pallor, anemia, and renal failure. 4. The client diagnosed with nephrolithiasis who has hematuria and is complaining of pain, rating it as a 9 on 1 to a 10 pain scale. 12. Which action by the licensed practical nurse, LPN, requires intervention by the critical care charge nurse? 1. The LPN has the trough drawn after hanging the aminoglycoside. 2. The LPN changes out a sharps container that is over the fill line. 3. The LPN asks another nurse to observe wastage of a narcotic. 4. The LPN inserts an indwelling urinary catheter into the client. 13. The unlicensed assistive personnel, UAP, reports to the nurse the client's urine output has bright red blood. Which intervention should the nurse implement first? 1. Instruct the UAP to take a urine specimen to the laboratory. 2. Document the findings in the client's nursing notes. 3. Assess the client's urine specimen and complete a renal assessment. 4. Ask the UAP to take the client's vital signs. 14. The charge nurse is making client assignments. Which client should the nurse assign to the graduate nurse who has just finished orientation? 1. The client with a cystectomy who had a creation of an ileal conduit. 2. The client on continuous hemodialysis who is awaiting a kidney transplant. 3. The client with renal trauma secondary to a motor vehicle accident. 4. The client who has had abdominal surgery and whose wound has eviscerated. 15. The charge nurse on the renal unit is notified of a bus accident with multiple injuries and clients are being brought to the emergency department, ed. The hospital is implementing the disaster policy. Which action should the nurse take first? 1. Determine which clients could be discharged home immediately. 2. Call any off-duty nurses to notify them to come into work. 3. Assess the staffing to determine which staff could be sent to ed. 4. Request all visitors to leave the hospital as soon as possible. 16. The 18-year-old client diagnosed with renal trauma is admitted to the critical care unit after a serious motor vehicle accident resulting from driving under the influence. The mother comes to the unit and starts yelling at her son about driving drunk. Which action should the nurse implement? 1. Allow the mother to continue talking to her son. 2. Notify the hospital security to remove the mother. 3. Escort the mother to a private area and talk to her. 4. Tell the mother if she wants to stay, she must be quiet. 17. The nurse is caring for an 84-year-old male client diagnosed with benign prostatic hypertrophy. The client has undergone a transurethral resection of the prostate, TURP, and is complaining of bladder spasms. Which intervention should the nurse implement first? 1. Administer an antispasmodic medication for bladder spasms. 2. Calculate the client's urinary output. 3. Palpate the client's abdomen for bladder distension. 4. Assess the client's three-way urinary catheter for patency. Chapter 6 Renal and Genitourinary Management 143 Questions 18. The nurse is caring for clients on a surgical unit. Which client should the nurse assess first after shift report? 1. The client diagnosed with polycystic kidney disease who has AB/P170/100. 2. The client diagnosed with bladder cancer who has gross painless hematuria. 3. The client diagnosed with renal calculi who thinks he passed a stone. 4. The client with acute pyelonephritis who has nausea/vomiting and is dehydrated. 19. The 78-year-old client with Alport syndrome asks the clinic nurse, "What should I do so I won't get sick this winter?" Which priority statement is the nurse's best response? 1. You should not be around any crowds during the winter months. 2. It is recommended you get a flu vaccine yearly. 3. You need to eat 3 well-balanced meals a day. 4. Dress warmly when it is less than 40 degrees Fahrenheit outside. 20. The elderly female client tells the nurse, "I have vaginal dryness and it hurts when my husband and I make love." Which priority intervention should the nurse discuss with the client? 1. Tell the client to discuss hormone replacement therapy with her HCP. 2. Encourage the client to refrain from having sexual intercourse. 3. Recommend the client use a vaginal lubricant prior to intercourse. 4. Explain to the client that vaginal dryness is not uncommon in the elderly. 21. The elderly female client diagnosed with osteoporosis is prescribed the bisphosphonate medication alendronate, Fosamax. Which intervention is priority when administering this medication? 1. Administer the medication first thing in the morning. 2. Ask the client whether she has a history of peptic ulcer disease. 3. Encourage the client to walk for at least 30 minutes. 4. Have the client remain upright for 30 minutes after administering the medication. 22. Which nursing task should the nurse on the renal unit assign to the licensed practical nurse, LPN? 1. Insert an indwelling urinary catheter before surgery. 2. Turn and reposition the client every 2 hours. 3. Measure and record the urine in the bedside commode. 4. Feed the client who choked on food during the last meal. 23. The nurse on a medical unit has just received the evening shift report. Which client should the nurse assess first? 1. The client with renal vein thrombosis who has a heparin drip infusion and a PTT of 92. 2. The client on peritoneal dialysis who has a clear dialysate draining from the abdomen. 3. The client on hemodialysis whose right upper arm fistula has an audible bruit. 4. The client diagnosed with cystitis who is complaining of burning on urination. 24. The nurse is preparing to administer medications. Which medication should the nurse administer first? 1. Digoxin, Lanoxin, a cardiac glycoside, due at 0900. 2. Furosemide, Lasix, a loop diuretic, due at 0800. 3. Propoxyphene, Darvon, an analgesic, due in 2 hours. 4. Acetaminophen, Tylenol, an analgesic, due in 5 minutes. 25. Which intervention should the nurse implement first when assisting a client with a flaccid bladder to urinate? 1. Perform the Creed-S maneuver on the client. 2. Perform intermittent catheterization on the client. 3. Place the client on the bedside commode. 4. Request the client to drink a full glass of water. 144. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 26. The nurse is caring for clients in a family practice clinic. Which client should the nurse assess first? 1. The male client with chronic pyelonephritis who has costrovertebral tenderness. 2. The female client who is having burning and pain on urination. 3. The female client with urethritis who reports dysuria, urgency, and frequent urination. 4. The male client who has hesitancy, terminal dribbling, and intermittency. 27. The nurse and unlicensed assistive personnel, UAP, are working in a family practice clinic. Which task should the nurse delegate to the UAP? 1. Give the client sample medications for a urinary tract infection, UTI. 2. Show the client how to use a self-monitoring blood glucometer. 3. Answer the telephone triage line and take messages from clients. 4. Take the vital signs of a client scheduled for a physical examination. 28. Which task is most appropriate for the nurse on the renal unit to delegate to the unlicensed assistive personnel, UAP? 1. Escort the client with acute pyelonephritis to the radiology department for a CT scan. 2. Obtain a sterile urine specimen for the client to rule out R/O, a urinary tract infection. 3. Hang the bag of D5W for the client diagnosed with post-streptococcal glomerulonephritis. 4. Provide discharge instructions for the client diagnosed for nephrotic syndrome. 29. Which task should the employee health nurse delegate to the unlicensed assistive personnel, UAP? 1. Request the UAP read the PPD result administered to the client 72 hours ago. 2. Ask the UAP to obtain a urine specimen for the client having a urine drug screening. 3. Tell the UAP to apply an ice pack to the client who slipped and has a sprained right ankle. 4. Instruct the UAP to complete the incident report for the nurse who had a dirty needle stick. 30. The nurse manager in the medical surgical outpatient clinic is making assignments. Which task is most appropriate to delegate/assign to the UAP/LPN? 1. Ask the LPN to administer the flu vaccine to the client. 2. Tell the UAP to call the pharmacist to refill a prescription. 3. Request the LPN to obtain the height and weight of the client. 4. Instruct the UAP to empty the trash cans in the client's rooms. 31. Which behavior warrants intervention by the clinical manager in the medical surgical outpatient clinic? 1. The UAP is discussing a client's condition in the waiting room. 2. The LPN is talking to a client over the phone about laboratory tests. 3. The RN is triaging phone messages during his or her lunch break. 4. The UAP is taking vital signs for the client being placed in a room. 32. The UAP in the school nurse's office is listening to a female student who is pregnant and scared to tell her parents. Which action should the school nurse implement? 1. Tell the UAP she cannot talk to the female student. 2. Call the student's parents and tell them their daughter is pregnant. 3. Do not take any action and allow the UAP to listen to the student. 4. Ask the UAP to leave and continue to talk to the student. Chapter 6 Renal and Genitourinary Management 145 Questions 33. The nurse observes an LPN discussing an intravenous pyelogram, a diagnostic test, with a client in the waiting room of the outpatient clinic. Which action should the nurse implement? 1. Praise the LPN for talking to the client about the diagnostic test. 2. Tell the LPN the nurse needs to talk to her in the office area. 3. Go to the waiting room and tell the LPN not to discuss this there. 4. Inform the HCP that the LPN was talking to the client in the waiting room. 34. The charge nurse in a large outpatient clinic notices the staff members are arguing and irritable with one another and the atmosphere has been very tense for the past week. Which action should the charge nurse take? 1. Wait for another week to see whether the situation resolves itself. 2. Write a memo telling all staff members to stop arguing. 3. Schedule a meeting with the staff to discuss the situation. 4. Tell the staff to stop arguing or they will be terminated. 35. The employee health nurse is obtaining a urine specimen for a pre-employment drug screen. Which action should the nurse implement first? 1. Obtain informed consent for the procedure. 2. Maintain the chain of custody for the specimen. 3. Allow the client to go to any bathroom in the clinic. 4. Take and record the client's tympanic temperature. 36. The client comes to the clinic reporting pain and burning on urination. Which action should the nurse implement first? 1. Assess and document the client's vital signs. 2. Determine whether the client has seen any blood in the urine. 3. Request the client give a midstream urine specimen. 4. Ask the client whether she wipes front to back after a bowel movement. 37. The nurse is working at the emergency health clinic in a disaster shelter. Which intervention is priority when initially assessing the client? 1. Find out how long the client will be in the shelter. 2. Determine whether the client has his or her routine medications. 3. Document the client's health history in writing. 4. Assess the client's vital signs, height, and weight. 38. The HCP orders an intravenous pyelogram for the 27-year-old male client diagnosed with R/O renal calculi. The client is diagnosed with schizophrenia and is delusional. Which action should the clinic nurse implement? 1. Ask the client whether he is allergic to yeast. 2. Request the client to sign a permit for the procedure. 3. Obtain informed consent from the client's significant other. 4. Discuss the local hospital's day surgery procedure with the client. 39. The home health aide tells the home health nurse one of the older male clients is taking an herbal supplement, saw palmetto, every day. Which statement is the nurse's best response? 1. Herbal supplements are dangerous and I will talk to the client. 2. Saw palmetto is used to treat benign prostatic hypertrophy. Let him take it. 3. I will notify the client's healthcare provider as soon as possible. 4. Many clients use herbal supplements. He has a right to take it. 40. The home health aide caring for the client who is postoperative kidney transplant asks the home health nurse, why is the physical therapist coming to visit the client? Which statement is the home health nurse's best response? 1. The physical therapist will evaluate the client's swallowing difficulty. 2. The physical therapist will assist the client with fine motor coordination. 3. The physical therapist will assist with caregiver concerns and making referrals. 4. The physical therapist will work with the client on strengthening and endurance. 146 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 41. The Home Health, HH, nurse is admitting a female client diagnosed with end-stage renal disease who refuses to be placed on hemodialysis. The client is ready to die, but verbalizes having so many regrets in her life. Which intervention would be most appropriate for the nurse? 1. Contact the agency chaplain to come talk to the client. 2. Call her church pastor and discuss the client's concerns. 3. Ask the client whether or not she would like to pray with the nurse. 4. Determine whether or not the client has an advance directive. 42. The nurse is preparing to perform a dressing change on a female client who has end-stage renal disease. The nurse notes the client's husband is silently holding the client's hand and praying. Which action should the nurse implement first? 1. Continue to prepare for the dressing change in the room. 2. Call the chaplain to help the client and spouse pray. 3. Quietly leave the room and come back later for the dressing change. 4. Ask the husband whether or not he would like the nurse to join in the prayer. 43. The unit manager on the renal unit is evaluating the staff nurse. Which data should be included in the